Thank you very much. In actual fact, before we can have a good understanding of this science business, we have to ask ourselves some fundamental questions. What is science? If you don't answer that question, you will never answer it properly either. If you don't ask that question. You see, science is a very heterogeneous discipline. We have physical sciences, biological sciences, chemical sciences, natural sciences. Mathematics is a science.
Social sciences.
Social sciences. So you see, the challenge is when you begin to consider science as mathematics and only mathematics, you will definitely have a problem. In my view, from the understanding of science and basic disciplines, the president is 100% right. Because if you were to look at everything just in the context of social science, there's a lot to talk about as far as taking the decision is concerned. You see, now let's look at one thing that the president said: contact tracing. So we had COVID-19, which initially we didn't even see it in the country when we started testing. And Noguchi were at the forefront. And then later on we found that, look, COVID-19 is here, but it is imported cases. Then later on we found that, look, COVID-19 has entered the community and community transmission has started. You see? And then the president takes a decision, a leadership government decision, to lockdown. Before lockdown, a lot of interactions are taking place. Even the Ghana Academy of Arts and Sciences has taken strategic moves and even met the president in the presidency. I was a member of the team that went. So many things have happened. Now, if you take even the mathematical science or the epidemiological science, take contact tracing. If you identify one person who is infected, potentially transmitting, and you do contact tracing, and you find that this person had had very, real contact with, let's say, 50 people, and you quarantine the 50 people, and then you look for whether any of them had acquired the infection, contracted the infection, and you find that out of that 50, maybe 0, or 1, or 2, it tells you something about the science of transmission, what's happening, you see. And then the president did something else as a national government decision to also begin to do social, community screening, which was inputted by many, many stakeholders, including the Academy of Arts and Sciences. You see, so the community screening provides additional information on what is happening out there in the open community. And if you screen 100 people, and you were to find that 70 of them are infected, or you screen 100 people and you find that 2 are infected, or 1 is infected, it is science, it has meaning. And based on that meaning, you can take some decisions. Now, assuming you screen 100 people and found that 70 are infected, I believe it will be wise for you to lock down. Because if you don't lock down, the remaining 30 will soon be also infected. You have to lock down and manage the situation rigorously, more, intensively. But if only 1 is infected, then you weigh it against other, and the president said it, other social and economic factors. What is the average strength of the Ghanaian family in terms of standard of living, ability to even get food to eat. There are families that if they don't interact with externally for a day, 2, 3 days, they will not eat. They won't eat at all.
Yeah.
Maybe some people are in Ghana, they don't know what is poverty. I know what is poverty. I know it real, as personal experience when I was a child. So please, you don't joke with these things. Because eventually, if you really understand epidemiology and disease transmission and epidemics and pandemics, you will understand that, look, if you are not careful, depending on where your people, the majority of your people fall in even nutrition and what do you call it, balanced diet and deficiencies in diet, if you don't know and you are not careful, what you realize is that you will compromise the ability of people to be able to even withstand COVID-19 infection to the extent that even immunocompromisation will appear to be the case. That is why when HIV/AIDS came, you remember, it was a Becky Tambo, Becky, South African president. When he said that HIV/AIDS is not caused by any virus, but it's caused by poverty, it's by nutritional. You understand? These things are intertwined. In today's science, in biomedical research science, we know that, look, nutrition and even immunology. So we talk of immunonutrition. So to say that there is no science really, it's because we have not defined what is science.
Okay.
Thank you.
Right. Now, Prof, let's get to very, I didn't anticipate that Bright perhaps will even have the capacity to get into this situation, the manner he went about it, and using the examples from Kole Klote and all of that, seeking to suggest that it may be a gamble to remove the lockdown.
Yes, thank you. Honestly, the Bright's analysis is very impressive. And that is part of how society is supposed to move. You should get different inputs, different impressions, different emphasis from different places and people. But I'll make some general comments. You know, in dealing with especially global health emergencies, the world has gotten into, or is getting into, new arenas. So in biomedical sciences, for example, we talk about emerging and re-emerging diseases or infections. So some are re-emerging in the sense that we know them and they come up in a different way, or like Ebola in West Africa, we had never had it before, and then it just came up like that. But then we have also emerging diseases like COVID-19. You didn't even know it at all. It's just come, it's introduced itself. So when you are also dealing with the response and control, the issues that Bright raised are very important, because diseases generally have characteristics. In Ghana, we have so many endemic diseases, and many a times they show us certain very interesting characteristics. Sometimes it's simple to understand, sometimes it's not that simple. Take a disease like bilharzia, blood in urine. We know that it is widespread in Ghana, but we also know that it is very focal in distribution. You find it in clusters in certain places, simply because of the way it's transmitted. Because it requires water and a vector, a snail vector. But then, if you come to a disease like COVID-19, we all see it as a pandemic, and we see it like a disease that is affecting a whole nation. But when you go deeper into the analysis and looking at it from the point of view of very expert epidemiology, you may make discoveries and then have even new strategies of dealing with it. And that is the direction that Bright has led us to, which is very, very good. Because the point about high density areas, now when you say lockdown, you know, you have to be very careful about what it means, because you have a society, a community, you have the demographic, you know, profiling is there. However, there is culture and sociology, and there is the way the community members, they live. So if you go to America or any of the developed countries and you do a lockdown, and virtually 90% of the community may be spread out beautifully in houses and homes. Now you come here and you find that in the high density areas, you would have locked down, but you have locked down clusters of people who, those clusters themselves require to be locked down. And that is the point. So that's the point Bright made.
Listening to you, the decision is based more on science, not quasi-science, but say socio-economic reasons. Cultural. The WHO has even warned that in Africa, it does appear if we are not careful with lockdowns, it is starvation and hunger that will kill our people more than coronavirus. Some governments are becoming unpopular now. Ramaphosa is not being enjoyed by South Africans who need food parcels because they queue, and for sometimes over 8 hours no food is coming. For sometimes it doesn't come at all. So if you extend it also as a government, you are looking at a situation where you might be faced with getting unpopular rather than the normal situation where presidents and governments have taken advantage of this situation to boost their ratings and popularity.
Yeah. So in reality, see, the point you have made is very important. I'll come back to what I was saying. You see, when you look at the world today and you ask the question, health, what is health? It is both physical and psychological well-being. You see, many a times we are looking at it only in terms of the physical, the bodily health. There's infection, there's no infection. But the psychological can be even more serious sometimes than the physical, you see. And that is health, you see. So the point that Bright made is something that you know, should be taken further on in terms of Ghana's response to COVID-19. That in these high density areas, we are beginning to see something, but we have to understand the phenomenon. You see, look at the way our households, family households are constructed. Sometimes we even call them, the places where individual families are living, we call them family houses. You see, it is a cluster by itself. So if we, let's say we impose lockdown, and these clusters are left untouched, no other issues concerning those clusters, and there is even one person infected in a cluster, you may end up by the end of about a few weeks, every member of the cluster becoming infected. Okay. You see, so that is the part of the issue, and I'm happy that he brings it out. So it requires certain decisions and actions to be taken, so that we can get out of it.
Let's now listen to this explanation about the polling, and then return to you on the questions of polling and testing, testing and polling. Let's listen. Our own, you know, journalists have been to speak to, you know, laboratory scientists or virologists, veterinary. In this, Latif Idris has gone to speak to some of them, and we have this explanation to share with you.
The VSD.
Yes, the VSD.
And for other coronaviruses through some PREDICT project and others. But with this pandemic, we started testing from 28th of March, where we received the first RNA extract from Noguchi. So usually when we get a sample and the sample comes in here, we have our team, the team of doctors and technicians who work together to do the sorting. Sorting usually means that we compare the sample ID with the sample container to do matching. Each container comes with this document.
Okay.
So they have to make sure that every container is having a document attached to it. That is what
so this document has the name of the
individual.
Okay,
individual.
that we don't want to show because of
So
confidentiality
that's the
issues.
name of the individual and where the sample is coming with a specific sample ID.
Okay.
So this will accompany the sample sent by Noguchi to our facility here at VSD. And when it comes here, our team, like as you can see from there, are doing the sorting. So you can focus on them and see they are doing the sorting. So they sort the sample up to know that the number of samples tallies with the paperwork that comes with it. We have the samples coming in the container. They have already pulled the sample and we spray around it.
Okay, so this is the pooling that we've been hearing about?
This is the pooling sample. So these are 10 samples pulled together. So we'll do the extraction of this RNA. So this is a pool sample that we've been hearing about. So we have this sample, we have added everything in and pulled this sample together as one sample. So when we run this sample and it becomes positive, now we have to go back to identify the individual sample to know which individual is positive among this pool sample. That is all the pool we are talking about.
So this is what you have as a container?
Yes.
And then you put it in...
Yeah, so we put this one into an Eppendorf tube.
Okay.
You can see from there, they have collected a sample into an Eppendorf tube or cryovials and give it a special ID. So as you can see, they are adding normal saline to the tubes and collect the sample in a pool into one small vial called Eppendorf tube or cryovials. And that sample will be sent to the BSL-3 laboratory for the RNA.
Right. Prof, help us understand better.
Yes.
What is this, polling all about?
Yeah, I think it's a very good question and it's good for people to understand it. Let me explain it simply this way. You see, when you have a pandemic like COVID-19 and everybody is concerned and it is spreading and you don't know where it is and you are testing for it, okay, you would want to quickly identify people who are infected so that you can feed the data into the analysis that the epidemiologists, the statisticians, what Bright is bringing out so clearly, you see. Now, you look at your testing capacity, and this is very good I'm saying this. Earlier on, some weeks to months back, I spoke to the media. I was asked the question, what is Noguchi's testing capacity in terms of ability to, number of samples to analyze in a day? I said, oh, it's about 1,000, 1,200, 1,500.
Excuse me, quick
Now,
question. Have you stopped screening for all the other programs that use the RT-PCR and dedicated everything to COVID?
we have stopped everything and dedicated everything to COVID. You see, a good question. So you see, so some people have heard that. So you said that your capacity is 1,200, 1,000, let's say 500. Now, how come now you said now your capacity is 5,000? So let me explain it. You see, in normal times, at the beginning, we were testing 10, 50, 20. Our maximum is 100, But as things are changing, the University of Ghana Noguchi Memorial Institute for Medical Research, we have a mandate. And you have to understand our mandate to understand how we work. Our mandate is so clear that we should conduct, novel research into infectious and non-infectious diseases. Our second mandate is to build capacity. Capacity, especially through training, especially training the next generation of scientists, and also training health professionals. You see, that's the second. The third mandate of Noguchi is to provide specialized diagnostics and monitoring services, surveillance, you see. So Noguchi is a biomedical research institute of global, standard, high standard. We are expected to develop new diagnostics, and we have the capacity to do that. So when we started testing COVID-19, and we take one sample and put into one, slot for RT-PCR, and then we realize that, look, we are now being confronted with the escalated, sample, testing, the enhanced testing. What does our professional competence tell us or direct us to do? Where is the innovation which still puts us in excellence without compromising? That is where we looked at the analysis of samples by pooling. By pooling, what it means is this. You take 10 samples. You take a little bit of each into only one tube. Now, into that one tube, you have a little bit of each. But the question is, if you test this tube, should only one of these be positive? Will you pick it? So we did those, analysis and standardization to ensure that using known positives, to ensure that as little as it is there will be picked positive. Wonderful. Now then we become very happy and strong because we have realized one thing already. Science is observation, analysis, and critical, foresight and movement. That's what science is. So we were happy for one reason, that majority of samples we are testing turn out to be negative. So if we take 10 and then we test it like I've explained, and the testing will go with positive and negative controls anyway. So we'll check our positive control and negative control if they are working. And then if the sample comes out to be negative, because we've done the robust analysis and the standardization, we know that these 10 samples are negative.
Okay.
You see, we don't have to be by force always testing one at a time. No. Science and research and development and innovation, it's not like that.
And necessity is
a matter of invention. Now, do you know this thing that I've just explained, the meaning? You won't believe it. Previously, if we took 100 samples and we tested, it's 100, isn't it? Now, if we do the pools of 10 and we test 100, we have tested 1,000 people. Have you seen the difference?
Right.
So I said that our capacity was 1,200. And I'm saying again
but is it a foolproof that there is no chance of compromise if you put 10 bits of 10 samples together and you test them at a go?
Very good.
It is not possible that you may have a positive in 9 negatives that will not show up.
That is why we did the robust analysis to standardize a test. We don't just do it because we want to do it.
Okay.
We did it with clear protocol, using known positives, and because the known positives, we can even reduce the amount of viral RNA in the positive. We even reduce the amount of viral RNA, even in the positive that we are adding to the remaining 9 to make 10.
Right.
And then still take portions of even the one that has been reduced. And then we found that our system could pick it.
All right.
So if you can pick it, what is the problem? We don't have a problem. That is science. So then we moved on. So when we say we pool, that is the meaning. But let me tell you something. This pooling thing is wonderful and good for us. But we need to be extremely careful in the future. And that is why it is very important that we saw what the VSD, Noguchi, building capacity. That's our second mandate, build capacity of health professionals. You see, something can happen if we are not careful to control the spread of COVID-19 in Ghana. And the number of positivity goes up. If it goes up, to the extent that if you take, let's say, 100 samples, maybe about 30 are positive, we can't pull anymore. Because almost every 10 that you take from 100 will have at least a positive.
Okay.
Because whenever you get a positive test, you now have to disaggregate. Okay. And disaggregation is not disaggregation. You now have to go and test the individual samples
from which you took the
from which you got a positive.
Okay.
Are you seeing? Okay. So we have to be extremely careful for the future, not to let this, COVID-19 continue to spread to a point that.
So let's get to know a bit more of some specifics. And like you guys have done, and I think you deserve all the praise for this innovation. Of course, the world is innovating as COVID-19 is forcing us to. Even the use of ventilators.
Yes.
Now they are doing split use. One ventilator is being used for as many as 4 people, and that wasn't the case normally. Right. So when we deal with the specifics, we want to know the number of samples that you may have dealt with so far, the number of samples you have processed,
So at Noguchi, as at yesterday, we had tested a total of, we had actually processed a total of 80,273. And we had tested 75,687. And of course, we know the positivity and things like that, the number of positives and things. So that was the broad picture. And of course, the government figures that it brings is not just Noguchi figures. It is adding KCCR. Now, Noguchi, we have trained the veterinary, VSD. Theirs will be added. We have also trained, National Public Health Reference Laboratory. Theirs also will be added. We've also trained CSIR. That one too will be added. So the picture brought by the government, arranged system is the global one. And if you compare it directly with that of Noguchi, you end up now having people becoming confused. And that has to be done very cautiously. Okay.
What sort of samples are you collecting? Throat swabs, sputum, stool? Okay. And what's the advantages and disadvantages in either of these?
Again, you see, when you mention the ventilators, some few weeks or months back, if you made a suggestion that one ventilator will be used for 2 people, even just 2 at the same time, medical professionals will tell you that you are mad. There's something wrong with you. Because there could be cross-infection. But as you yourself, you said, necessity is the mother of invention. Now that we realize that if we use one ventilator on one person, 3 people will die, we find a way of using it on 4 people without cross-infection, because the concern is cross-infection. I hope you get it. Yeah. And we have already mechanisms and measures that we can use to avoid cross-infection. We have so many filters, different kinds, different types. There are filters we call HEPA filters that no pathogen can pass through at all, and it's already there and we know. So you can prevent the cross-infection. Therefore, you can do that. Now let's come back to the testing. The standard testing for COVID-19 required the use of the swabs.
Nasopharyngeal?
Nasopharyngeal, using through the nose for the back of the throat, and also through the mouth, also for in the close to the, a better inside. Now, when you take these swabs into the collect the samples. They are designed, they are not cotton swabs that are just brush like, you know, they are specially designed, and they will pick mucus from the linings of the nasopharyngeal, esophagus, name it what. It will pick, you know, mucus from there. And because of the nature of this infection, if you just brush a little bit of mucus, you are picking millions of viral cells, which is too much even for what we need for testing. So that's how come the test standard-wise is done. However, it got to a point that globally, there were no swabs. You can't get a swab to buy. The whole world. So do we fold our hands and say that, okay, no swabs, we can't test anymore? Or we will do exploration to see whether we can have alternatives. So what we did was then to again do operational research within program research, operational, and take the few swabs that we have which are available, use them alongside another type of sample collection that we already know. We have tuberculosis already in Ghana. We collect sputum always for tuberculosis. So what about collecting, because we want something from in there. What about collecting the sample as if we are going to do tuberculosis, examination or testing? And then let's check and see whether the swab and that kind of sample, what will it tell us? What will it give us? And that investigation showed that, look, the person who is positive by swab is positive by sputum. The one who is negative is negative. So, you see, this is life. This world, you know what, I used to be the president of the Ghana Red Cross Society. We talk of first aid. One of the most important rules about first aid is that whenever you have to save life, you must be trained to the extent that you can use the materials that are available to save the life. Not that you say that, oh, I don't have a stretcher. You don't have a stretcher. What do you mean you don't have a stretcher? You can make a stretcher with shirts and sticks. I hope you get the point. Yes, that is what science is. And that is what we do. We have to do it because we are supposed to be creative and create science ourselves and introduce new methods and approaches. So it is important for the public to understand what is the University of Ghana Noguchi Memorial Institute for Medical Research, and understand that we can do new things and introduce new concepts.
Good. So some people are interested in knowing whether even with the innovation that you have introduced, you still are challenged in a way or the other. We have discovered suddenly that there are quite a number of institutions in Ghana who can do some of these testing, except that, you know, we didn't plan about them, the nature in which we neglect our health institutions, leave them in a state that they are unable to do as much. Yet this situation is forcing them to do a lot. For the first time, I'm getting to know about the National Public Health and Reference Laboratory, all of them doing some of these things. What challenges are you facing by way of the capacity questions?
Okay, so let me talk to the innovation and challenge, and then I come to that. So as you introduce innovation, of course, you introduce also new challenges or problems. One of the challenges that we have encountered, which is not a difficult thing to deal with, is where you collect the sputum, and the sputum is put in a container like you saw the VSD, you know, and sometimes some people who are packaging the sample are not capping the container well and can allow a leakage. But unfortunately, anytime there is a leakage, Any other sample together with that leakage cannot be tested or analyzed because we cannot tell whether the leakage contamination has taken place, you see. So that is one challenge. Now, apart from that, you find that it goes fairly smoothly, okay. And then the second part of your question, can you repeat that for me? So the second part, yes.
So I was just seeking to know what are some of the challenges that you would face, you're currently facing.
In terms of the capacity building.
Yes, and you have made us also know that you are supposed to also help all the other institutions, you know, as it were. And we are getting to know that there are pockets of these institutions around the country, but they just have been neglected. And I mentioned the National Public Health and Reference Laboratory, for example, who are also doing some of these, but what's the capacity? How much can they do? What help can they get? So you can free up Noguchi and KCCR.
So some of the very interesting capacity challenges we have had is, first of all, certification. Before any other unit can join the COVID testing, we should be able to certify the personnel who are doing the testing, and also the facilities they are going to use to do the testing. So training, going to the site and training the people there is okay. But to certify, you need to have more information to be able to be sure that I guarantee that this person will do an excellent job. One thing we have done as far as that is concerned is that people who will do the analysis in the various units, we let them come to Noguchi to work with us for a period of time as part of the training. So they also see what happens at Noguchi and have first-hand, you know, experience. And so that one has helped us to overcome that. The other second very interesting but unique challenge is that if you come to Noguchi, University of Ghana, Noguchi Memorial Institute for Medical Research, and you see the way we work and the way we are set up, we are expected and obliged to meet international standards. So there is something called Quality Management System, QMS. And then other, you know, accreditation, good laboratory practice, ISO and things like that. QMS, for example, is so critically important because to handle samples like COVID-19 has so many biosafety issues. Even the laboratory scientists, the personnel working in the testing themselves can be exposed through unintended, you know, release, or name it what. And so it is so important that even the unit that is going to join the testing meets a certain criteria. And sometimes you may find that there are so many other units who could have joined, but they cannot because they will not meet the quality criteria.
Okay.
So one of the other things we should do, which WHO has already started, you know, building the capacity of laboratories to be able to meet quality standards. It's a very important thing generally for laboratories in Ghana. And there are so many laboratories who don't meet standards, especially some of the private ones. You see.
All right.
Things like that.